Good afternoon, this is Narayan. Today I am making a PowerPoint regarding a case study on a patient. A 65-year-old man who was working as a cashier and cook in a restaurant had a vacation, and he had a trip to sub-Saharan Africa to see his family members, friends, relatives, brothers and sisters. After spending a month and few more days of his vacation back to his country, it was time to back to America and returned to his workplace. While he was working a few days later, he showed up some symptoms of fever, headache, diarrhea, vomit, weakness, and some chest pain. But before he traveled, he did not have any of those symptoms other than some seasonal flu and diabetes. He was taking metformin, 500 mg metformin for diabetes. At the same time, he came to the nearest emergency department at Adhikari Medical Center and complained all about those symptoms he had. Here in the picture, we can see he's complaining those symptoms to the doctor. But the part of the country he traveled was a lack of sanitation, where different diseases are transferred from animals to animals, from human beings to animals, animals to human beings, and from flies to like mosquito bites to the animals, and mosquito bites to different people, and transmitted from contaminated water, contaminated food and drinks. While he was complaining about a lot of fever, chest pain, and headache, the body temperature was taken. It was 39.1 degrees Celsius, which is higher than the normal. The normal body temperature is 37 degrees Celsius. The patient's heart rate was 140 bpm, blood pressure was 145 by 90 mmHg, which is higher than the normal. The respiratory rate was 30 breath per minute. Well, patients do not have any swelling, edema on all his body. Here we can see a doctor is taking the patient's physical, is listening to the patient's lungs. There are different ways the patient gets fever, because he was complaining about the fever, lot of the headache, and chest pain. Well, patient was complaining about fever and a lot of mosquito bites when he was back to his country. And while he was complaining about a lot of mosquito bites, we assumed to have all those mosquito borne test or mosquito disease, the disease caused by mosquito bites. So as per that, we took the patient's blood and sent it to the laboratory department to see all mosquito borne diseases. Here we can see in a picture a mosquito biting a person. A mosquito is biting a person carrying a plasmodium. When this mosquito bites a person carrying a plasmodium, flies to the other person, bites the different person, the person not having any plasmodium. Now the mosquito transfer the disease from one person to another person. On other picture, we can see a patient lying in the bed, having a lot of headache, and he is holding an ice pad on his head too, and there is a thermometer kept on a side to see the body temperature, since he was complaining about a lot of fever and headache. When we send a sample to the laboratory department, the healthcare workers they did a PCR, polymerase chain reaction test, for to see any mosquito-borne diseases. PCR test was performed to determine the organism that causes all mosquito-borne diseases like dengue fever, yellow fever, or any kind of jaundice. But after 24 hours of wait for PCR test, it came negative, which means those mosquito-borne diseases like dengue fever, yellow fever, jaundice, they came negative. Those are the symptoms from the mosquito bites other than the malaria test. Now we went to the second step test. Doctor orders the different test to see if the patient is carrying any malaria positive in his blood, or the patient is carrying any plasmodium, malaria plasmodium, which which causes malaria. to the human beings. Now the blood was drawn from the patient arm and index finger. Here we can see a lab technician drawing blood from patient's index finger on a microscopic slide, and another picture we can see a lab technician drawing blood from patient's arm. This is drawn from the arm to do the rapid diagnostic test, and this is done on a microscopic slide for thick and thin blood smear test. The RDT kit and thick and thin blood smear kit looks like this. The RDT has a control line, test window, square hole for blood and round hole for buffer. Thick and thin blood smear looks like this, with the upper one with thick blood smear and the lower one with the thin blood smear. The RDT test came positive for malaria, which means the patient has a plasmodium in his blood. The control line and test line are visible on the RDT test. And on the other picture we can see thick and thin blood smear test. We can see the small microorganisms. They are like a ring shape, and some of them are like a headphone shape, which also proves that the patient has a malaria positive in his blood. Different tests are performed to see the patient is carrying any kind of diseases. We did all mosquito-borne diseases except for malaria, like dengue fever, yellow fever, jaundice. All those came negative from PCR test, which means all mosquito-borne diseases are tested and they came negative. But when we had the RDT and thick and thin blood smear test, that came positive for malaria, which means the patient is carrying plasmodium in his blood. Now we can see there are different ways people get malaria, different ways that plasmodium causes malaria. Those are like Plasmodium falciparum, Plasmodium vivax, Plasmodium ovale, and Plasmodium malaria. Even though there are different kinds of plasmodium that causes malaria, among all, Plasmodium falciparum causes more serious malaria, which is also known as black water fever, because hemoglobin from damaged red blood cells is excreted in the urine. Plasmodium falciparum causes fever, erythrocyte lysis of red blood cells ruptures, and their contents leak out into the bloodstream. After the malaria was tested positive or diagnosed for malaria positive, patient was transported to the ICU department. And when the patient is transported to the ICU department, doctor ordered the normal saline infusion for the extracellular fluid replacement for dehydration, because the patient had a poor normal intake of liquid or water. Patient was also provided with 3 different meals, like breakfast, lunch, and dinner, and lot of water. While patient was in the hospital, doctor also provide the patient with anti-malarial drugs for 7 days, and that is artesunate 120 mg and paramethine 75 mg while he was in the hospital. But after 7 days, it was time for patient to discharge, and patient was provided with all the discharge instruction for his right and responsibilities. Also provided with anti-malarial drugs, which is chloroquine 1000 mg for 7 weeks, and patient had the follow-up appointment after 7 weeks. When patient came back after 7 weeks, he do not have any complication of malaria in his blood. He do not have any kind of symptoms as before. And here we can see the patient started working in his same place as before, serving his customers, and he was enjoying his life working together with his co-workers. Thank you.